Hi there again, Eagle County. My name is Heath Harmon. I am the Director of Eagle County Public Health and Environment, here to bring you a little bit of an update on one of our mental health goals, which was increasing the number of school-based counselors. So since our last quarterly update, there's not a whole lot of new information to present. So we're still doing really good in terms of increasing the number of school-based counselors in all of our public schools, both on the Roaring Fork Valley as well as the Eagle River Valley. So doing great there. Still a couple of challenges. The amount of time it takes to submit some of the paperwork for Medicaid reimbursement decreases the amount of clinician time. And then we still have a housing challenge. And so at least one of our positions is not being filled just yet because of those housing concerns. But nevertheless, I think we're on the right track. I think the last quarter, we also talked about new funds coming into the community through the school district and through a federal grant that will help support this. So we're on track to moving towards sustainability, which is great. So when these initial funds go away, we think that we'll be able to sustain this in the longer term, creating really good access for all of our youth, which is extremely important for us right now. So what I want to do is I want to spend just a little bit of time talking about things beyond just the school-based counselors. And so there's a number of different things that are happening in our community right now that all help in terms of providing better service for mental health needs. The Mental Health Advisory Committee is meeting right now to develop a vision for the next 3 to 5 years. This is great because what that will help do is figure out what the role is of the Mental Health Advisory Committee and providing funds into community-based organizations to help improve access to services. In addition, we're doing this in collaboration with Eagle Valley Behavioral Health so that we understand what Eagle Valley Behavioral Health's role is going to be. But nevertheless, we're really wanting to make sure like the services can really just zip up and provide the right amount of balance in terms of prevention as well as intervention and then treatment services to meet the community's needs. In addition to that, we have the first 2 applications are probably coming in within the next month or so to help improve transportation. So if someone is struggling with a mental health crisis and they need to be transported out of the community to a facility on the Front Range or even out in Grand Junction, the transportation services that we're looking to provide will ensure that actually our Eagle County paramedic services aren't taken offline to provide that transportation, but rather another transportation service that will be licensed here within Eagle County will be able to do that. So that's a win-win for us as a community. And certainly a couple of years from now when we have an inpatient facility, that would be that's the best case scenario because we won't need to transport folks out of the community. So there's a quick snapshot in terms of where we're doing really well as some things on the horizon. So look forward to giving you another update in about 3 months' time.